One of the most common complaints that doctors hear during doctor-patient visits is fatigue.
I hear it all the time. I'll bet half of my patients have fatigue.
You probably get tired of hearing about it.
Well, there's so many different reasons why we get fatigue that we need to look into, and that's part of what we're going to talk about today.
Well, there are many causes for being tired that can range from not getting enough sleep to our bodies not making enough energy. And what's the main way that we make energy? We inhale oxygen and exhale carbon dioxide to keep our bodies running, right?
Right.
Well, it turns out that this is only part of the story. According to new breakthrough research, all previous studies on this topic are incomplete. They're missing a major factor that we didn't know until now. We need nitric oxide
Exactly.
to get the oxygen through our blood vessels and to regulate the amount of oxygen that we need to make energy. So, maybe we should start with just talking about what oxygen is. I mean, where oxygen travels and where the nitric oxide comes in.
Yeah, well, actually, all three of these things are important, and they go back to the simple thing, the hemoglobin molecule. The hemoglobin molecule is something that's in the red cells. All of our red cells carry hemoglobin, and it's the hemoglobin, Vicky, that attaches to oxygen, carbon dioxide, and nitric oxide. And we didn't know that. There were some studies that were done that came out of a research project that was really very interesting, because what they did is they went ahead and blocked the receptor site for nitric oxide. And when they did, they found that you couldn't deliver oxygen to the tissues. So the question is, what's going on? How does this happen?
So you could be breathing in a lot of oxygen. You could be in the hospital and have a nasal cannula where you're getting oxygen, and it's not doing any good because you don't have the nitric oxide.
Because you can't get it to where it needs to go. So what happens is this nitric oxide is important in releasing oxygen from an enzyme that's in the energy-producing part of the cell called the mitochondria that allows oxygen to get to it. So when there's a lot of nitric oxide present, because we've been eating the right foods and we exercise and we build up our endurance to be able to create nitric oxide, then we can go ahead and when the blood flow in the capillaries of the body gets to where the oxygen needs to be released, there's enough nitric oxide there to release it. Then it gets into the tissues by dilating up those blood vessels in the region where oxygen is needed. And that's new information we didn't know.
So where does this enzyme come into play?
Well, the enzyme is in the energy powerhouse called the mitochondria. It's called cytochrome C oxidase. And it's a very interesting enzyme because it regulates the amount of oxygen that gets into the body. When there's a lot of nitric oxide present, what happens is it blocks the receptor's ability to bind oxygen and deliver it to the energy-producing part of the cell, so it can make an energy called ATP, which is the energy currency of the body.
So how does a person know if they have enough nitric oxide to make their oxygen effective in their bodies?
Well, you wouldn't know, but you would be tired. I mean, if you're fatigued, and a lot of people, they come to the office and they're complaining, I'm tired, and we do all the routine lab tests we can, and they look normal. And when you look at how oxygen is delivered to the body through the lungs, that's the first thing. You have to make sure people don't have lung disease, so they can bring enough oxygen in. Then it gets into the bloodstream, where the blood vessels in the lung meet with the little air sacs in the lung, and that takes the oxygen to the rest of the body. Now, if we don't have the mechanism to release that oxygen into where the body needs it, you'll have plenty of oxygen in your blood, but not enough in your tissues, and you can't make enough ATP, and you will be fatigued.
This sounds maybe like it could possibly be the cause for chronic fatigue syndrome.
Oh, and for many other diseases, because when you look at every disease that we have is associated with inefficient oxygen utilization. What does that mean? It means basically that when our bodies cannot produce energy like they should, there are going to be defects in what the body can do, because those tissues that are supposed to have a certain function may not be able to do the work they're supposed to do, and so you'll have a deficiency there. And that certainly will show up as fatigue, but it may show up as lung disease or maybe heart disease, because every disease is associated with inefficient utilization of oxygen. That's why we do this so-called CPET test, which is a cardiopulmonary exercise test that allows us to be able to determine by exercising people, measuring their oxygen consumption and carbon dioxide production, to tell you whether or not you're sick and oxygen utilization is low, whether you're just deconditioned and can't make enough ATP because of that reason, or because really you have psychological reasons for it. So this is a brilliant test that is utilizing all this biochemistry we're talking about to tell you yes or no, you have a problem or you don't. It's amazing.
I was just thinking about patients that are in the hospital that need blood transfusions. If the fact that the blood cells are frozen before they give them to somebody, if this could destroy the nitric oxide.
I don't know if the freezing does it, but certainly blood that has been in a blood bank for a while doesn't have the nitric oxide. It's all gone. And if you have fresh blood, that's different. We've known that for 50 years. When I was a resident,
it's pretty hard to get
people,
fresh blood unless you're out in the field.
Well, that's true. But it's an issue, and we didn't know why people who were transfused with older blood didn't do so well. I mean, it replaced their volume. You want to replace blood volume, but the oxygen carrying capacity and the nitric oxide carrying capacity was really in trouble.
Well, the other thing is that I think it's important for people to know what they can do to produce nitric oxide in their bodies, because obviously we need it.
Yeah.
So what can people eat, or what can they take for a supplement or a drug, or what makes it happen?
It's a bit tricky if somebody's sick. If they're not so sick, just staying healthy by eating seeds and nuts and vegetables are high in nitrites and nitrates.
Well, beets and leafy green vegetables
are the best. I mean, you could do a beet drink, have an 8-ounce glass of beet juice a day, and you'll be getting a ton of nitric oxide, and that'll give your body reserve to be able to do its work as we've been describing.
I was also reading where pycnogenol and quercetin could be helpful, along with L-arginine. Maybe you should address
Well, L-arginine is an amino acid, and the one that makes probably 95% of all the nitric oxide in our body. And the foods that I just mentioned and Vicki mentioned are the ones where we have the most abundant amounts of arginine. So that's
but
how we get it.
But you might not want to overdo it, though, either, with supplements. You need to have a health care practitioner supervise that.
Well, it's very tricky to know how to supplement with nitric oxide, because if you give too much, you're going to block the receptor site, that's in the cytochrome C oxidase enzyme I told you that's in the mitochondria that produces energy.
So it might backfire.
Well, you're going to block it, and then nitric oxide is going to displace oxygen from that place, and there'll be no oxygen to take inside. So what we have here is a very sensitive system of checks and balances. You must have enough nitric oxide to dilate up the blood vessels in the region where you want to increase oxygen flow. But if you give too much, then you're going to have a feedback inhibition mechanism that blocks the cytochrome C oxidase from carrying oxygen to make ATP, again, the energy currency of the cell.
Well, you talk a lot about the photon stimulator, infrared light therapy, and this is something that produces nitric oxide. It's
a very, very interesting thing. For years we've known that infrared light therapy does a lot to take care of pain, to reduce inflammation, to increase the amount of nitric oxide that's in the body so that oxygen carrying capacity is increased, and to produce more ATP. And that's why people get well with that. So we know now the mechanism by which that happens. And so using infrared and red light are the two things that have the most powerful effect at improving nitric oxide in the balanced way that it should be.
When you say red light, can somebody just shine a red light on it?
If it's the right wavelength, yes. But there are a lot of wavelengths in that area.
You're talking about LEDs then?
They can be LEDs, they can be lasers, they could be just lights in a flashlight that are the right frequency. And that's the trick, is knowing which frequencies to use and how much power to use. And that's why the devices we use are the best in the world, and nobody knows about them.
I think it was in the 1800s when they discovered nitroglycerin, wasn't it?
Exactly. So this is not new.
Somehow didn't catch on.
No, but we used it for people who were having angina, because the blood vessels in the heart, when they get narrowed and in spasm, if you can't supply enough oxygen to the tissues there, what happens is you wind up with chest pain. So we do the same thing with infrared light therapy. When somebody comes into my office, I don't have to worry about nitroglycerin. I just shine the infrared and red light over their chest, and the pain is gone usually within 30 to 60 seconds. And it stays better longer than if they take a nitroglycerin a lot of the time. But that's anecdotal evidence from my experience.
So this is something that people need to be aware of.
Absolutely.
And doctors need to be aware of. This is a new study,
So the best thing to do is to do your lifestyle medicine. We're always talking about what's the most powerful medicine in the universe, and it's lifestyle. So you need to eat lots of leafy green vegetables, seeds and nuts, herbs and spices.
Beets.
Yeah, lots of beets is a great way to go. And you need to exercise every day so you can build up your body's ability for the mitochondria to make more energy. And we have to try and be happy. We do all those things. Chances are you're not going to have to worry about all this complicated biochemistry that has to do with oxygen, carbon dioxide, and
Well, laughing makes a
nitric
lot
oxide.
of oxygen.
Yeah, that's nitrous oxide, maybe.
Oh.
Beautiful.
Ha ha ha.